So, welcome to this webinar. I'm so happy that you are all here. So, good morning, everyone, and a very warm welcome to all of you. Thank you for joining us today for this follow-up webinar to the MMS Symposium Commercial Determinants of Health, Markets, Power, and Human Rights. Whether you were with us on the 5th of November or you are joining this conversation for the first time, we are delighted to have you here. This session is open to all who are committed to understanding how commercial forces shape health and to exploring what we can collectively do to strengthen health equity. The symposium revealed powerful insights, how profit-driven systems fuel non-communicable diseases, for example, how commercial actors shape policy and weaken health systems, and how global inequalities are reinforced when markets are not accountable to public well-being. At the same time, we saw that community action, civil society advocacy, and strong public institutions remain essential drivers of change. Today's webinar is an opportunity to continue this dialogue, to move from understanding towards action. We are honored to be joined by Amber van den Akker from the University of Bath, whose expertise in commercial determinants and health governance will guide us through the key reflections and practical entry points for action. Our aim for this hour is simple: to connect, reflect, and identify where we are at the moment across NGOs, academia, policy, and civil society. And where we can join forces to strengthen accountability, fairness, and health protection in a world shaped by powerful commercial interests. Before we begin, a few practical notes. Please keep your microphones muted unless giving speaking time. We will have a Q&A session later on, and you are more than welcome to put your questions and ask your questions. And during the sessions, you can use the chat box at any time. So thank you once again for being with us and for bringing your experience, your perspectives, and your commitment to this important work. With that, it is my pleasure to hand over to Amber to begin our sessions. And Amber will introduce herself a bit more so that we know a bit more where you're coming from and what your ambitions are. Okay.
Thank you. Thank you so much, Karine. And thank you so much for having me. Really nice to see so many faces here. My name is Amber. I am from the Netherlands, and my background is as a policymaker in the Netherlands in mental health policy. I went and worked with the World Health Organization European region for a while, again working on policy, and then did my PhD at the University of Bath, where I now also work still as a researcher on a grant called Local Health and Global Profits, where we're really trying to tease out what local government can do to address the commercial determinants of health. So I will just share my screen. And I'm assuming you can all see that okay. Good. So what I want to talk about today is from understanding to actions. So what can we do to address the commercial determinants of health? But importantly, why are a lot of these actions not yet happening? So what is happening in the system, in the policy-making system, in the governance system that is not allowing some of these actions to emerge? And what can we do to support these actions, coming to fruition and being developed and implemented? So I've introduced myself. My research is funded by UK Research and Innovation, which is the UK government. The project that I work on, Local Health and Global Profits, does not accept funding from commercial organizations whose interests are not aligned with improved public health, and I have no additional interest to declare. So we're talking about the commercial determinants of health today. I'm not going to go over what the commercial determinants of health are, because I know that you've covered this in your recent symposium. If you are interested, I would recommend you look at the Lancet series on the commercial determinants of health, especially the paper by Gilmore. What I want to do instead today is, as I said, to delve deeper into this underpinning system and look at what is needed to shift the system and how the system itself might be resistant to these changes or help facilitate them. So action on the commercial determinants of health is often represented by the model you can see on the screen and can focus on three key elements. The first is what we in public health are often familiar with, which is the determinants of health. You may recognize the shape of this model, which is quite similar to the social determinants of health. And this encompasses the environments that people live in, but also the wider policies that affect them. And again, the broader political and economic system, including the privatization of public services, deregulation, financialization. Second is the commercial sector, their practices, their growth strategies, their business models. And third is the system and the underlying drivers. So power, norms, and externalities in particular are being teased out here. And so many public health interventions sit within this determinants of health section in this rainbow model. They change the environment or they focus on framing the problem. And we know quite a lot of policies that are effective here that focus on affordability, availability, accessibility of specific products, for example, advertising ban of specific products, shaping the environment through planning, putting taxation in place, earmarking the revenue for public health services. We know a lot of these things that are effective. There's quite a lot of evidence out there. But a recent review in The Lancet found that NCD policy implementation has stagnated, and that the implementation of those related to unhealthy commodities in particular is actually decreasing. And so that leads us to ask, why is there this gap between what we know about the problem and what we know some potential solutions are, and actually being able to act on and implement these solutions? And to understand that, we really have to look at the second and the third element here. So we have to look at the commercial sector and the system that underpins this. And while we are talking about the commercial determinants of health today, they cannot be seen as separate from social, political, and economic determinants. So while we talk about health, we also have to talk about inequality, environmental damage, and social injustice, as these are all linked. And fundamentally, this is a systems problem. So with the advent of neoliberalism, we can see the shift towards larger and more powerful transnational corporations. Sorry, I don't know why my slides keep changing. There we go, back to this one. So we see these more powerful transnational corporations with huge profit margins. We see these oligopolies emerging, which is in the circle on the far left. And they use their power to shape norms, to influence regulation. So as I was saying, we've got these large transnational corporations that have increasing profit margins. They shape norms and they influence regulation. And that leaves them able to both increase sales and reduce costs. And both of these can lead to harm. So if the product that they produce is damaging to health, increased sales lead to harm. We know this for tobacco, gambling, foods high in salt, sugar, and fat. But if they reduce costs, for example, by reducing labor standards or taking shortcuts on waste disposal, that also leads to harm. Health harms, the injuries in warehouse workers, but also environmental harms and all the harms that are associated with that. And then if we shift to the green circle, because this increased harm leads to additional costs which are borne by people and by the government. This in turn reduces public wealth and the ability to spend on public goods like healthcare or housing. So what we see is that on the one side, we have these winners who increase their profit. And I just want to note here, it is a few winners. We don't see small, medium enterprises because they are often increasingly unable to compete. Instead, we see these increasingly large transnational corporations. And on the other side, we see the losers of this system as the costs are being borne by the public. And while we are talking a lot about money, this is not just an economic system, this is fundamentally a political one. So regulation, for example, to shift the costs onto the polluters rather than on public institutions through polluter pays taxes, can help change this system. But that's not what is happening at the moment. The four industries that are listed here, the ultra-processed food, tobacco, fossil fuel, and alcohol industries, are some of the most damaging industries in the world. Although as the cost of their harm has risen, this study in 2022 on US listed corporations shows that the effective tax rates have fallen. So this shows that over the same period, the value of wealth transferred to shareholders has increased almost exponentially. So it's not that there is less wealth or income in the system, it's just that there's less distributed to governments through taxes and more distributed to shareholders, including executive and investors. And that's why we see the wage gap between the lowest paid workers in companies and the CEOs, that gap is increasing as well. And what's the result of this? So this is a graph from the World Inequalities Report, and it shows that private wealth has increased while public wealth has decreased across the world. Over the past 40 years, countries have become significantly richer, but their governments have become significantly poorer. And so the share of wealth held by public actors is close to zero, or in some countries, it's negative, including in the UK, for example. And this means that the totality of wealth is in private hands. And of course, this lack of wealth for governments has important implications for the state capacity to tackle inequalities now, as well as in the future, facing key challenges like climate change. And one way to understand these inequalities is to focus on the gap between the government's net wealth and the private sector's net wealth, and understand the ways in which the inequalities and the power differences between the two plays out and shapes the system of the commercial determinants of health. So going into talking about what that power actually means and what that looks like. The way we talk about power in the context of the commercial determinants of health often focuses on the sources of power and the operation of power. And when we look at the sources of power, aside from the monetary or material power, there's also the ideational power. This is knowledge, technology, and the perceived legitimacy of an actor in a political process. So, for example, do we think the tobacco industry is a legitimate partner in public health policy because they have the technology to create vapes? And how this power plays out, the operation of power, is in three ways. So there's instrumental power, which is direct influence through lobbying, for example. There's also structural power, which is having structural access to the policy process, which in turn changes what decisions can be made. And I'll explain this in a bit more detail later. And there's also discursive power, which is shaping the interests and ideas of others. So shaping norms. What do we see as normal? And just to give an example of instrumental power, this is the lobbying expenditure of the alcohol, gambling, tobacco, and ultra-processed food industries in the US. And I want to highlight two things in this graph. First, it's the massive amount of money that is being spent on lobbying. So between 1998 and 2020, the ultra-processed food industry spent $1.15 billion US dollars on lobbying in the United States. Why spend so much revenue if that doesn't have an impact? So the peak you see in 2009 is because that year there was a federal soda tax considered. Lobbying spending went up by a huge amount, and this tax in the end did not pass. But the second thing I want to highlight here is that regulation to address these things does work. If you look at the yellow line, which is the tobacco industry, that has a massive decrease after the Master Settlement Agreement came into effect in 1998. And their lobbying spending went from $110 million to just over $35 million. Now, the other thing to mention here is that 64% of the lobbyists that are represented in this graph were former US government employees. And that shows the impact of direct access and revolving doors practices as enablers of instrumental power. When we talk about structural power, what we're really talking about is who has a seat at the table. And I find this a really powerful picture because it is all these CEOs of some of the largest companies in the world who are at the front row of the inauguration of the US president. And so, who has a seat at the table? Who has the ear of the political system? And who can influence what decisions are being made? You know, what we often see is that when corporations do have a seat at the table, they advocate for partnership approaches where the industry is a part of the solution. But what is the solution that they're proposing for? We know is often not regulation. Discursive power, where they shape what we perceive as normal. The narrative that they often have is that proposed regulation will lead to negative social and economic outcomes, or a dystopian outcome. And by changing the way we think about what the impact of regulation might be, we change what we see as within the realm of the possible or the acceptable. The impact of all this power is that it serves to maintain this current system of norms and wealth, and the externalities to continue to be borne by the public sector and by people. Now, this discussion of power can sometimes feel quite abstract still. So to give a little bit more detail, I want to go over some of the corporate practices and how they play out within this system. And in the interest of time, I won't go through all of them, but I will focus on scientific and political practices as particularly relevant here. And in both of these, conflicts of interest are a key enabler as they allow commercial actors to exert this influence and sometimes in invisible ways. So looking at scientific practices first, we know that industries purposefully try to shape the research agenda and influence science at all stages of the scientific process. And this is not a problem of bad scientists. I just want to emphasize that. It's not scientists, doing bad things. It's a wider systems problem where the industry funds and amplifies research that aligns with its interests and discredits research that does not. So, for example, in the 1950s, the sugar industry was very aware of the harmful impacts of sugar on teeth. And so they influenced the US National Institute of Dental Research to deflect research priorities away from that harm. And more recently, a review shows that researchers with financial conflicts of interest to the food industry were 5 times more likely to report no positive association between consuming sugar-sweetened beverages and overweight or obesity. So they also cast doubt on the evidence of harm that we have on some of these products. And all of this, of course, influences what evidence makes it into the policy process. And then we can look at the political practices. What are some of the goals? Are mostly here to normalize industry as an essential policy partner, disenfranchise public health, constrain public health to maintain this focus on the individual, and denormalize precautionary approaches. And what we do see is that this is common across tobacco, alcohol, ultra-processed food, and gambling industry. And all these activities are also sometimes called the industry playbook, and they include things like framing the policy space, threatening legal action, manufacturing public support through creating front groups or astroturf organizations, shaping, distorting, or undermining evidence, and accessing the policy process through conflicts of interest and lobbying and so on. So what's the impact of this? The impact of industry involvement, we know, is that it delays, dilutes, or abandons effective policy measures. It results in policies that are focused more on individual behavior rather than structural policies. So they focus on information provision, education, and media campaigns, rather than supply of food, for example, or the environment in which people buy food, the affordability, or things like taxation. It also focuses more on voluntary measures rather than regulation, which we know are less effective, and it often includes industry as part of the solution. All of these things, industry pushes for them because they know that it won't affect them. They can continue with business as usual through these policies. It's important to note as well that industries do not just shape specific policies, but they also seek to change how policy is made. So we know that the food industry and many other industries work together with the tobacco industry to push for better regulation at the EU level. And thanks to internal industry documents, we know that they did so specifically to make it more difficult to pass public health regulation. And earlier this year, the WHO identified better regulation as a policy approach as a barrier to implementation of the Framework Convention on Tobacco Control, saying that it creates access points for commercial actors. And more recently, what we also see is that the industry continues to push for partnership approaches. So rather than regulation, we want to be at the table, we'll be your partner, we'll help you do these things. So the industry frames partnerships as good governance and the industry itself as a legitimate and necessary partner in policymaking. And these are quotes from documents by the food industry. And what does these partnerships look like? This is an overview of everyone who was involved in global multi-stakeholder partnerships to create a healthier, more sustainable food system. And the bigger the circle, the more partnerships they were involved in. So we see some governments and international organizations, the FAO, European Commission, World Bank, the Dutch government, Swiss government, German government, who are people that you would expect them to be at the table when you're talking about global food policy. But actually, the biggest category is the private sector. So all the blue circles are all private sector actors. And we see some of the big one, we see Nestle, Unilever, Bayer, PepsiCo are involved in so many of these initiatives, and often in the same initiatives as the FAO or these governments. And so having a seat at the same table allows them to influence what policy solutions are able to emerge from these partnerships. And when we talk about what emerges from these partnerships, I think it's important to emphasize that there is actually no independent evidence that partnership approaches as a whole work. Instead, what we have is evidence of case studies, some made by the people who are in the partnerships themselves, often funded by the industry, but the independent case study evidence repeatedly shows that the partnerships are diluting the policy that is made. They weaken the self-regulation, shift framing towards individual responsibility, and are not able to cope with the power imbalance that is in the room. So the graph you see here on the right is an analysis of the interventions that came out of the UK Public Health Responsibility Deal, which was a big high-profile partnership. And what we see is that the majority of interventions were very downstream. So they were really focused on providing information. But crucially, what we also saw is that a lot of these interventions, the industry was planning to do them anyway. So whether they would have taken part in this partnership or not, this would likely have happened. But the government had spent resources, time, effort on this partnership with no real result to show for it. And as part of my research, I spoke to a lot of people working in these types of partnerships, people from the industry, from NGOs, academics, and governments. And almost to a T, they said, we don't have this right. We don't protect against conflicts of interest. We don't know what to do with the power imbalance in the room. We don't know whether we're focusing on the right thing. But I'm sure the other partnerships do, except almost all of them said this. And that's because there's such little transparency that there's no actual independent scrutiny of what is happening in these partnerships. And there's almost no evaluation of the long-term outcomes of these partnerships. So by looking at this wider system, the way power plays out, how corporate practices impact how policy is made, what solutions can emerge, that's key for enabling action on the commercial determinants of health. And it also shows that we must act across the system. That includes changing business models, corporate regulation, good governance. And some of these actions cannot, of course, be done at local or national level, like international trade agreements, but many actually can. Now I just want to touch on some key enablers for being able to act across the system. This is by no means an exhaustive list, but this is just what we know from the evidence are things that are important to be able to act at all. And the first key thing is to create more public sector resource. We saw the increasing gap between public resource and private sector resource. And if the public has no resource, they must always rely on externals to bring that in. So examples of how to do this can be through innovative taxation on tobacco, alcohol, or sugar-sweetened beverages, which can then be earmarked for spending on public health or can be used to fund independent science and civil society groups. The second is that it's key to have an independent, well-resourced and coordinated civil society action. We know that the corporate playbook is highly coordinated across industries, and so it's important for civil society to be similarly coordinated, to foster collective solidarity around shared goals and build coalitions. A few things to highlight here, the importance of independence. We know that industry actors create front groups, which put out evidence or which manufacture public support for specific options, even though that's not what the real public support is for. The other thing to note is that none of this means that you cannot work or interact with industry at all. That's not realistic, I don't think. I think it's important to think about the difference between the transnational corporations and small and medium enterprises, or those enterprises who might have interests that are aligned with what you are trying to achieve. The picture I've got on the slide here is for the Worker-Based Social Responsibility Initiative in the US. And what they have done is they have worked with indigenous groups, and they have created a pledge together with the indigenous groups, which they have then presented to the industry. It was Ben and Jerry's in this case, presented to the industry for the industry to sign and say, yes, we will agree to do this. And if they signed, that obviously came with positive PR, and that was good for the industry. But if they didn't sign, that came with the negative PR. But the important thing is the industry was not at the table for developing the pledge. They were only given it the finished product, and they had the decision to sign or not to sign. And I think that's a good example of where civil society was very coordinated, had a very strong message of this is what we want, and you can agree to this or you cannot agree to this. Third is to put health and well-being at the core of systems. So a lot of our systems currently are driven by profit and by financial gain. The food system is a good and much criticized example. The corporations are in the system, they are in place to create profit. That is fine, that is their mandate. But the state's mandate is to protect the health and well-being of its citizens. So things like health and health policies, well-being economies, they're all pathways to achieving this, as they fundamentally put the health and well-being of people at the center of what they do. But none of this can happen if we do not safeguard the integrity of public health decision-making. And so we have to protect policy against undue corporate influence. And these things won't come from institutions alone. Tobacco control has been able to be successful and push for the Framework Convention on Tobacco Control, and that was in large part due to effective civil society mobilization, emerging independent research, and changing public norms. And the FCTC was put in place in response to corporate malpractice from the tobacco industry and recognizing the fundamental conflicts of interest between tobacco industry's profit incentive and public health. And its principles are to limit interactions, ensure transparency, reject partnerships, and stop conflicts of interest. And those are key for us to be able to move forward to act on other industries as well. That's all I had for now. Very happy to take any questions, and just have to go through our acknowledgements and our social media.
Well, thank you so much, Amber, for taking us through and for this very insightful presentation. I would like to open the floor for questions for the Q&A session.
Yeah, thank you. You can hear me?
We can hear you.
I'm Andreas from Medical International. Thank you very much, Amber, for this really, really good tour de force on the topic. There's one question that I confronted, not sometimes, but I know from debates about this question on how regulation of states, and if they are imposing restrictions on individual choices, and this nanny states argument that is exploited heavily also for the question of what are healthy food, what is healthy drink, what is culturally necessary, also when it comes to alcohol in our countries. Is this something that, is there a systematic try to really deal with this? I think this kind of skepticism towards public policy is not just, I think it's not just by the corporate sector, but it is very much an issue. I think if we need to find way moving forwards, then this might be also come up, and you will have some ideas about this or others in the room. Thanks.
Yeah, thank you. Absolutely. The resistance against public policy and the restriction of choice. But what we often see is that is an argument that is very heavily featured in the media. But what we have coming out, there's one paper that's currently under review where we took a citizens jury. So we had a number of people across the UK to really think about this topic. And there's some public opinion surveys that have come out of the Netherlands and the UK that I'm aware of that show that people do actually support the government taking action on a lot of these things. Because yes, people don't like having their choices restricted, but at the moment their choices are also restricted because healthy food is less affordable, and they see advertising everywhere. There is so much availability of unhealthy food, so there is actually quite a lot of support from people for the government to just create a more level playing field. So often when we try to steer away from the argument on the nanny state, what we will say are things like creating a level playing field, making sure that people have options, removing corporate influence. The other angle that to think about how you can address this, the other angle that's really powerful is to talk about children. So how children are being manipulated through advertising or through what they can buy in schools. I don't know if that answers your question, but there is evidence emerging that there is support for this. And I think there are some ways in which we can reframe what we do to not have as much the risk of being accused of nanny statism, but instead talking about the level playing field and the choice environment and creating a healthier environment.
Thank you, Amber. Thank you, Andreas. Who else has a question? Who would like or a statement?
Hi, Amber. I'm Martin, Medicus Mundi, Switzerland. Just coming to what you have reacted to Andreas' point before, I think really what plays here in and probably what is quite important as well here is that the people there as well, or many people are as well skeptical. There is quite a big skepticism towards big industries, towards big food, big tech, you name it. And then there is a sort of an understanding within, I think, broad part of the population that the market has to somehow work in a fair way. And they see when they know how these big industries behave, they feel somehow as well betrayed. And I think this is something that could be exploited as well better in our advocacy work.
Yes, absolutely. I mean, I know when we work with local government in the UK, we often make this distinction, right? So when we talk about the commercial determinants, we're not talking about the local, father who owns the chicken shop and has run this in the family for 3 generations. We're talking about McDonald's who are coming in, so this distinction. And then also, I think that's why it's important to talk about, when you talk about political influence and how corporations influence politicians, that is mostly large corporation. And it's mostly large transnational corporations who then don't pay tax in the country, right? So they have this influence, but they don't bear any of the consequences of their actions. And I think you're right, that is a very, very powerful angle to take.
I have a quick question, also maybe a radical statement. Because I'm a little tired of the impact, that big particularly processed food has, not just in Switzerland, but across the globe. I'm from South Africa, so I've seen the impact of what big food can actually do and how it can change and divert the health of a nation. Has there been any thought about using a percentage? So, for example, if your profit is X within this country, using a percentage of that to offset the impact of the burden of disease on the healthcare system. So like a fine.
That would be great, but I haven't heard of that happening yet. No, so the closest things to that I can think of are polluter pays. So making making corporations responsible for their waste, for example. So we know Coca-Cola is the largest producer of plastic waste in the world, and they don't pay for that. So things like that, or taxes, so taxation on sugar-sweetened beverages. So Thailand has a really progressive tax on alcohol. I'm not sure if they also have it on food, but they earmark that specifically for public health services. That is the closest I can think of what exists, but I don't know if any of what you say exists yet.
Yeah, for me, it's also interesting because it's like you cause a problem and then you take money from them to fix the same problem that they cause. It's like having a hole in the bucket and keep putting water in, and then whatever comes out, you put it back in again. For me, eventually, hopefully it makes some inroads. We need data because most of this is fairly new, but it can be, for now it feels a little bit like a zero-sum game because they have so much more water to put in, right? So that amount that they're paying is not sufficient to actually hit the bottom line. The question is, if they're never going to go away, how do we deal with them? Because of their marketing and what they actually put towards marketing, it's also quite difficult to with your small public health campaigns to actually try and circumvent that or try and overcome the impact they have on people and their choices. That's me done. Thanks.
No, absolutely. And I think how do you address that? They're not going to go away, right? Because they make profits, and that's fine. Their corporations are there to make a profit. That's absolutely fine. And I think that's why it's important to keep them out of the political system, so that the political system can actually function in the interest of the public interest, and try to create ways to make it just not financially viable to run these operations and to sell these products in this way. And people have to try to do that with tobacco. We see the tobacco industry diversifying towards vapes. Their public story is that they invest in vapes so that they transition out of the tobacco industry. But some of my colleagues went to the shareholder meeting of one of the tobacco industries here in the UK. And actually what they told the shareholders is, no, we've got a new market here. We've got an untapped market who we can sell vapes to, but we maintain our market of cigarettes, right? So they diversify. And it's very, very difficult to change that, aside from making it just not financially viable. And to do that, you need to keep them separate from the political system so that can act in the public interest.
Thanks.
Yes, Tayana?
Hello, perhaps I could add to that new nicotine thing. I am Taija Voutilainen. I work in the Finnish Institute for Health and Welfare in Finland, and I lead a task in this joint action prevent non-communicable diseases project that focuses, my task focuses on alcohol and tobacco policies. And what we've found out is that these new actors that have come to the field, for example, these vapes and nicotine pouches, they are not that well regulated in Europe compared to tobacco, and they are not also part of the Framework Convention on Tobacco Control, because that classification of the tobacco product is something that has something produced from the tobacco leaves, and these new products are use nicotine that is synthetic, so they can kind of skip the regulation and be used either by the tobacco industry or then by the new actors to gain this kind of a legitimate place in the tables where they can influence the policies once again. So we have a kind of a hole in the bucket in that sense. And that's also one thing that they do in promoting these products, is that they are part of the solution and try to increase the harm reduction narrative. And as Amber said, that they are not really giving up on selling cigarettes. They are just finding new ways to increase their profits. So that's just a comment.
Yeah, thank you. It's yeah, good to hear that there are similar experiences across Europe, but also not good to hear that there are similar experiences across Europe.
Thanks for sharing. We have Andreas. And
yeah, thank you. I think what one experience that we know is what might be important is to really constrict commercial actors to their business, basically, and not make it easy for them to expand into philanthropic actions. What we had in Germany, and it is also an international campaign, this no free lunch idea, to say, particular among professionals, this general acceptance of sponsorship by private actors is a big problem. It's in medicine. I know it, of course, with the big conferences and things. So these generally accepted thing, and it's happened, of course, with Coca-Cola is organizing a running sports event, and the big food industry is interested in this to not be blamed to be responsible for obesity. So these kind of trying to restrict the space that business has for their business, rather than open these doors for this. And that, of course, needs public funding, because if you cannot fund your sports activities by public funding, then you are led to look for donors, and this kind of very usual way of thinking about how to get funding for our work. I know it also from the AIDS activism movement, this question in how close and what kind of business they want to do with the pharma business, the pharma companies, was sometimes contested, but not very often. So this might be also something that is a bit closer home. Then it's not about education, the general public, but rather also making good showcases of your own responsibility regarding the private sector. Thanks.
Yeah, I think that's a really, really important point. And I would recommend, if you haven't read it yet, there's a book by Jonathan Marks, who's a law professor, called The Perils of Partnership. And he sets out very clearly what the risk is to public institutions when they partner with the private sector, which are the things you mentioned.
Thank you. We have one more. And I don't dare to, Mladen Poluta.
Yes, hello, good morning, good afternoon. I'm also from South Africa, but I don't know Mandy, but I'm new to this group, so pleased to meet you all. My background is in primarily public sector healthcare, and specifically health technology assessment and management, but with a strong interest in health system as opposed to the healthcare system. It would appear that most of the participants in the conversation are from Europe. And so my question would be, in terms of what is being discussed and suggested, is there a European initiative that in a sense could become a pilot or a living laboratory for other regions in the world, in terms of what is being proposed? And linked to that, how do you see the role of the World Health Organization in all of this? I know that they've been very much weakened by the cuts in funding, but is WHO, should it be a part of this discussion? And if so, what would be the linkages to them? Thank you.
Yeah, really good questions. There are, let me start with your second question first. So the WHO used to have a team on the commercial determinants of health, which I worked in, which has been cut due to funding. The WHO European region has come out with a report on the commercial determinants. The global report is still in draft. So there is interest from the WHO, and they were taking a stance on it, but with all the restrictions that you've said, which are very difficult, I think they should take a stance. I think they fundamentally have to, but recognizing that it is also very, very difficult for them to do so. There are some other regions in the world that are very powerful on this. So I know the small island developing states, they have developed a report specifically calling out economic and commercial determinants as a key driver of harm in their region, which is very, a very politically powerful move for them to do. UNICEF is very powerful in the commercial determinants of health. They have a policy of not engaging with the private sector at all. But there are differences across the UN system. The FAO is maybe less strict on those things. In terms of whether there are things happening across Europe, yes, a number of things. I probably won't know all of them, but things like Finland is doing pretty well. They've got, in terms of well-being and having well-being at the center of what they do. Wales has got a Future Generations Act, so their policy has to take future generations into account, which in the commercial determinants of health is very big, because you cannot just focus on current short-term profits if you need to think about what all this commercial activity means for future generations. And there are some cities that are taking quite a lot of action, restricting advertising, clean air zones, just having positive procurement as well, where cities try to procure goods from local businesses rather than from the big transnationals. So there are pockets of innovation all around. I think probably more can be done to coordinate those. And that is where the role of the WHO could come in quite strongly.
Thank you.
So thank you all. I think we are coming slowly but surely to the end of this powerful session. Is there one more question? Otherwise, okay, Andreas.
Yeah. Sorry for speaking so much,
good.
because it was on WHO, and we had also the WHO responsible with us in the symposium, but she also could not say, or she was not, because she technically problems happen. Do you know about this? Is this report from WHO published released anytime soon? Because we are a bit skeptical if WHO will do a big splash about it, or if they will bury it a bit like at the sidelines because they feel it might be too controversial. Can you share some insight into this, or is it a black box for you as well?
I do not know. So I knew when I worked with them, but that is a few years ago that they were working on it. But I don't know what the plan is at the moment. I'm sorry.
Yeah, maybe an apologies from my side. I tried to interact with Monica more from WHO, but unfortunately it wasn't possible. I didn't really receive any feedback, so I'm not sure where we are standing there. Martin, you also raised your hand.
Yes, indeed. Yes, indeed. Sorry, we have 7 minutes, so I thought maybe we just use the time we have. No, for me, it was quite interesting, Amber, to hear as well what you talk now about cities, and you mentioned before as well the collaboration with local governments. Here, I'm quite interested if you can explore a little bit more how what you recommend to local governments, how they can act. Because I think this could be quite powerful to learn more here.
Yeah, absolutely. I mean, the first thing I would say is if you're interested in this, I can share with Karine just what, our research project, and you can keep in touch with the findings as they come out. Things like advertising bans, licensing restrictions, planning restrictions. So, for example, no hot food takeaways within 400 meters of schools, or the thing that can be done at local level, which is quite powerful, is using the local data. So what is happening in your local area? What are the key problems here, and how can we specifically target to address these? But all of this sits within the caveat that a lot of this will require action at national level, because we know that industries do start legal action against local government, unfortunately. Very well resourced legal action against under-resourced local government. And so if there's no national framework, it's very difficult to keep this action and implement it. So collective advocacy is actually a key one for the local level. Collective advocacy up to the national level, while also learning from each other, from where these pockets of innovation do exist. But I'll share my email address, but also our newsletter and our website, so you can keep in touch with the research findings as they come out over the next few years.
Yeah, I'm more than happy to put everything together and send it all out to you in our final email. Yeah, super. I have one more question for you, Amber, just to wrap up a bit the session of today. If you had to choose one high impact intervention to reduce commercial harm in the next 5 years, what would it be?
Easy question to round up.
Super.
If I had to choose one intervention, I think it would have to be taxation, like polluter pays taxation, making companies pay for, even if it's just the pollution, like the physical pollution they put into the environment throughout their processes, the harm that their products cause, even better. But even if it was just taxation of the pollution that they cause, which then goes into public health funding and builds public resources, I think that would be a key one where we could see quite rapid results.
Good. Thank you so much, Amber, for taking the time and being with us. It was absolutely fantastic, and I